All right. So, humor therapy. So we're going to go over humor therapy. What is it and how does it work? Well, humor therapy is a complementary or non-conventional therapy that can either work on its own or alongside conventional medicine. It has been found to help chronic pain and increase one's overall well-being through various means such as games, funny movies, funny TV shows, and laughing exercises. Studies found that clowns or doctors that dress as clowns help decrease children's anxiety before surgery. Uh, Physiological changes that happen with laughter. So it increases immune fighting antibodies, increases endorphins, it increases lung capacity, abdominal strength, and then it also decreases stress hormones such as cortisol, growth hormone, and epinephrine. So the history, humor's been around basically since we've been alive. Humor is a Latin word, and it means fluid or moisture. And during the medieval period in Europe, bodily fluids or humor were associated with different types of moods. So the body fluid of yellow bile was associated with melancholy or being depressed, black bile, anger and hostility, blood, happy and cheerful spirit, and then we have phlegm, which is associated with apathy and sluggishness. So if someone produced too much of one of these fluids, it allegedly created a mood change, and it subjected that person for social ridicule, and therefore the first comedians. Balanced fluid meant that the person was in good humor. The Middle Ages in Europe and the eastern portion of the United States, Christians believed that laughter was actually an act by the devil. So if someone was seen laughing out loud, they assumed that that person was possessed. So if you notice, for hundreds of years, people didn't smile in photographs. One of the main people to really bring attention to the medical community for humor therapy is Norman Cousins, and he basically legitimized humor therapy as being an intervention to help fight diseases, which it helped his rare disease. And as he participated in humor therapy, it actually put his disease into remission. For the first findings of the studies that I looked up, we have one about humor therapy for older adults. The purpose of this study was to conduct and examine humor therapy in relieving pain and increasing overall well-being in older adults. So the methods, it was a quasi-experimental post-test. It invited 2 nursing homes to participate in an 8-week program. The experimental group, which had 36 individuals, created a portfolio, and it had various different things within this portfolio, such as funny articles, movies, and jokes. And then they would view this portfolio once a week, along with lectures on humor therapy, and then they were also given different types of exercises. The control group received nothing. After the 8-week intervention, there was a post-questionnaire that was filled out by both groups, and then additionally, the experimental group gave feedback about the humor therapy. For the results, the experimental group showed significant decreases in pain and loneliness scores compared to the controls. And the experimental group also showed increases in happiness and life satisfaction compared to the controls. For the second article, I found research on laughter therapy for postpartum women. And the purpose of this was to examine the effects of the immune response, specifically an globulin that's found in breast milk, SIGA, in postpartum women after they were given laughter therapy. And the methods were, it was a convenient sample of 78 postpartum women, 38 in the experimental group and 38 in the control. The experimental group participated in a 60-minute session twice a week for 2 weeks. And then breast milk was measured to evaluate the SIGA levels. So the results for this, there were significant differences between groups. The experimental group had less of a decrease in the SIGA, indicating higher levels of antibodies in their breast milk compared to the controls. And so for a summary and conclusion, humor therapy has been around for thousands of years and has been considered to help heal the mind, body, and soul. Humor therapy has been shown to decrease pain, improve lung and abdominal strength, increase antibodies, and decrease stress hormones. Studies have shown that implementing humor therapy in older adults' lives has helped decrease their chronic pain, increase their overall happiness. And additionally, making laughter therapy part of the post-care for postpartum women has been shown to help slowly decrease in antibodies in breast milk. And for you guys to implement humor therapy into your lives, I found this TED Talks. And if you click on the link, it will give you about a 5-minute video on laughter therapy. And you guys can follow along and see if it makes you guys feel any better. And references, and that's it. Thank you.